So we are into second part of the reproductive health. First part we have already seen in the form of defining the reproductive health. Then we have tried to understand the problems and the strategies, right? The problems in Indian society and what are the strategies the government of India employs to make the Indian society a reproductively healthy society. Yes, in the form of introducing sex education in the schools and as well creating awareness in the form of audio, visual, and print media in coordination with non-governmental organizations, parents. Right, by creating awareness, what goals can be achieved also, we have seen in the first part of the reproductive health lesson. Now, in the second part, what do we see briefly here is we have this important segment for exams as well. The important segment that we have is there is this test known as amniocentesis. Right, there is this test known as the amniocentesis, very important test to detect to detect the abnormalities in the growing fetus. Right, so it is a prenatal test. Right, this amniocentesis is a prenatal test, so that we can write here. So this amniocentesis is a prenatal, so a prenatal test, right? A prenatal test. And why it is conducted, why it is conducted is it is conducted to determine congenital abnormalities, right? So it is conducted to determine the congenital abnormalities in the developing fetus. Yes, as easy as that. We are trying to understand the congenital, that means the birth abnormalities, the birth abnormalities in the developing fetus. How would you do that? How would you do that is by determining the chromosome pattern. By determining the chromosome pattern, you are trying to understand the genetic abnormalities or the gene abnormalities. So it leads to if there is any problem in the developing fetus. And when is this test is conducted, right? When is this test conducted is normally it is conducted after the end of first trimester, right? So after the end of first first trimester, first trimester, that means after the end of 12 weeks of pregnancy. So it is normally is conducted from 14th to 15th week of pregnancy, or sometimes you can say 14th to 16th, or as long as 14th to 18th as well, 14th to 18th as well. So in the span of this 1 month, that is 14th to 18th week of the pregnancy, this amniocentesis test that you are seeing can be conducted. And what is happening here in this amniocentesis test, what is happening here is to explain you that. So what I have is I have a diagram here to give you better understanding of the test called as the amniocentesis. So here you can clearly see the diagram that is presented here. So in this diagram, what you are seeing in here is you are seeing a woman who is pregnant, and you are seeing her developing a baby inside the womb of this woman. Right, in this amniocentesis, we can clearly see the baby is floating in the sac, a bag here. We have a bag here. So in this bag actually is called as this amniotic sac. Right, this one is actually the amniotic sac, and this amniotic sac is filled with the amniotic fluid. If you recall, we have 4 extra embryonic membranes. Yes, we have 4 extra embryonic membranes. And what are these 4 extra embryonic membrane is One, the outermost of all is the chorion, followed by the amnion, right? Followed by amnion, and then we have the yolk sac, and then we have the allantois. Four extra embryonic membranes are there. Among these, the membrane that we are concerned now is the amnion, right? We are not discussing the chorion, yolk sac, and allantois now. We are seeing the significance of amnion. So this amnion layer is in the form of this amniotic sac, and the sac is filled with this amniotic fluid. And what is the significance of this amniotic fluid? Now, the amniotic fluid that is there, no, so this fluid contains the fetal cells. Yes, this amniotic fluid contains the fetal cells. Why does it contains the fetal cell? Obviously, as we grow we living will also shed some cells, right? So we shed some cells as the life of the cells ends. So all these cells which have been shed by the body in the case of the fetus are collected in this amniotic fluid. Now we need to collect these cells. You need to collect these cells and study them for any genetic abnormalities. To perform this procedure, right? To perform this procedures, the expert doctors, what do they do is they have these two instruments. One of this is a long needle connected to a syringe, and we have this transducer. For the sound waves, transducer for the transmission of the sound waves. What is the benefit of this using this transducer is to make sure you are inserting the needle in proper direction without harming anything, right? Without putting the mother or without damaging the sac itself, because this fluid is very essential for the development of the fetus. And if you rupture this sac and the fluid leaks, it's going to be problematic to to the pregnancy itself. It might lead to the termination of the pregnancy. That is why, so it has to be done very efficiently with the expert doctors. Okay, now what is happening here is with the assistance of this transducer, what we are doing, so we are inserting this long needle, rupturing this sac and collecting this amniotic fluid. Approximately how much can you collect is some 10 to 15 ml of the amniotic fluid can be collected here, and this collected amniotic fluid is studied for any gene abnormalities. That is a procedure which has to be done very efficiently with the experts. Yes, so this is the guidance diagram that we have here. So hope you have some idea about that. Now, when you study the chromosome pattern, right? Obviously, you are studying the chromosome pattern. What are we finding out? What are we finding out is, so as a first significance of this amniotic procedure is you are finding out the genetic abnormalities. So obviously we have that here. So we're finding out the genetic abnormalities. I don't need to write that, so since it has already been presented here, so you can see here it is used for to find out the genetic disorders. We have given 3 genetic disorders here, that is Down syndrome, hemophilia, and sickle cell anemia. So these two will be known, right? So we'll have idea about whether the fetus has any of these genetic, apart from these other genetic disorders will also be known for us in our NCERT study book. So these 3 disorders have been mentioned, and when you have these 3 disorders, what happens is it will be determined whether these disorders will uh, will will lead to the survivability of the fetus or not, right? So it's a call of the doctor to explain clearly about the lifestyle the child uh, is is going to be having once she is born, or when the child it is born with these disorders, right? So it's obviously going to be complicated life because of the nature of these diseases. How is she going to be having the complicated life is, Down syndrome is a condition where this child will have less number of chromosomes, right? Sorry, it's not actually less. It's a trisomic condition. Down syndrome is a trisomic condition. uh, so that's why one chromosome extra will be there. One chromosome extra will be there, as a matter of fact, in 21st chromosome, right? Trisomic condition will be there. So this child will have some complications. And hemophilia is a condition where uh, the hemostasis will be there, right? The blood clotting will not happen. That is hemostasis. Blood clotting will not be there. And sickle cell anemia is the condition. Obviously, you can see it's an anemic condition because the RBC has attained the shape of a sickle, right? So all these conditions will make the fetal life survive, the child life survivability complicated. So that is where the doctor can explain the genetic abnormalities and the problems this child is going to have if she is continue to live. She is continue to live. So based on the call of the doctor and the guidance of the doctor, the couples can take a decision regarding to continue the pregnancy or to terminate the pregnancy. Okay, so to terminate the pregnancy, we have this medical termination of the pregnancy. So under the guidance of the doctors, the recommendation of the doctors, a pregnancy can be terminated. So in a situation where the survivability uh, of the of the fetus is less, and as well she may not have the fruitful life that is expected. Yes, that is the importance of this amniocentesis test. And the next, what we get to know is, we also get to know the metabolic disorders, such as deficiency of some protein and enzymes and hormones. We all know the significance of proteins and as well as enzymes, particularly the enzymes, the use of their acceleration. Enzymes are catalysts for some metabolic reactions, many metabolic reactions. In the absence of these enzymes, will make the metabolism difficult or complicated. So in such a situation, this child may also have the problems. Example that we have for a metabolic disorder that we have is phenylketonuria is one example where this child will have complication. That is phenyl phenylketonuria. Ketonuria, or simply we can say it as PKU. And we have a separate study on this in the genetics chapter. We'll be dealing with this phenylketonuria there. It is also a metabolic disorder. So that also will get to know. And determination of the sex. Obviously, when you see the chromosome pattern, you would know the sex. You would know the sex, but the sex is not displayed in this amniocentesis test report. Right, the test is not displayed. And why it is not displayed is, we have this unfortunate scenario in the Indian society in the case of this female feticide. Unfortunately, the male child is more preferred over the female child because purely of ignorance. And so when the government creates awareness, it explains the importance uh, of the male and female child as well, and as well as equal opportunities for the both male and female child. But despite creating so much awareness, and there is still many cases of female feticide is happening, affecting affecting the ratio of male to female sex ratio, which is very problematic, especially in some states of India. So to reduce these cases of female feticide, this amniocentesis test is bad is bad to determine the sex. That sex should not be determined, which is illegal to conduct this test to determine the sex of the fetus. Yes, so that is why this test has been banned, particularly to determine the sex of the fetus. And ultrasonography is normal pregnancy procedure that has been conducted nowadays. Nowadays, and these three you would get to know anyway, right? So to recall what we have understood, the amniocentesis test is, so it's a prenatal determination test, right? Chromosome gene abnormality determination test, you can say. Yes, so it is primarily done for to understand the genetic abnormalities, and so once you study the genetic abnormalities, you would also know the sex of the fetus, but it should not be disclosed, not displayed to the parents or anybody at all. So it's not displayed. Yes, it's illegal to conduct amniocentesis test for these purposes. For these purposes, and we have seen simply the procedure how it is being performed with the assistance of this diagram. So we have taken this help of this diagram and have tried to understand the procedure called amniocentesis. Okay, very important area for your NEET exam as well. As well, the procedure called as amniocentesis. And the next part that we have is the brief important point for the NEET as well. There is this drug called as Saheli. There is this drug called as Saheli, which is developed by our research institute, that is Central Drug Research Institute, which is based in Lucknow in India, right? UP of Lucknow, Central Drug Research Institute, and it has developed this oral contraceptive pill, oral contraceptive pill, and we'll try to understand this oral contraceptive pill again when you study the various contraceptive methods that are available. And now, so what you need to be knowing at this stage is, so it's a drug that is developed by Central Drug Research Institute, and the name of this drug is Saheli. Saheli, right? So by doing all of this, right, to sum up what we have seen in the previous lesson that we have discussed, and the lesson that we have now is, so now we have created the awareness, right? We have created the awareness about sex related matters, right? And as well, by creating awareness, increased number of medically assisted deliveries can happen. What does that mean? You know, the institution deliveries, and as well better postnatal care. So once the assisted deliveries, institutional deliveries have taken place, and then we have the postnatal care, the importance of breastfeeding, and as well as what kind of care a mother has to be giving to her child, right? And as well as what kind of programs the government is giving for the fetus and for the child, and as well as for the mother. So that is the postnatal care. And when you do that, what happens? So there will be significant reduction, a significant decrease in the maternal and infant mortality rates, right? And as well, increased number of couples with the smaller families. While you have these couples with the smaller families, you are creating awareness about the contraceptives, and you are educating them about the importance of small families, right? Obviously, an awareness is created to the people of marriageable age, all right? To the people of marriageable age. So obviously, with this awareness, we can have smaller families, and as well as we can have less maternal and infant mortality rates, and as well better detection on cure for the sexually transmitted disorders. Yes, we can detect them early by awareness, or we can as well avoid them completely. And even if they are transmitted to these people, and if they are detected early, and we can provide a cure. So overall increased medical facilities, and as well as awareness about the sex related problems all indicate improved health of the Indian society, particularly, right? So that is the end goal that has been achieved by creating awareness, right? So hope we are clear about this amniocentesis test procedure. It is very important. And we'll be starting our next lesson with the population stabilization and the birth control, various contraceptive methods that are available. Thank you.